All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. And today we have a very special guest, Dr. Mariah Pate. Welcome to the podcast.
Thank you for having me.
Yes, I'm so excited to hear that you're local to Tampa Bay in St. Pete area and you're expert ENT. So tell us little bit about how you got into that and who you are and what you do.
All right, well, I'm actually a Florida native. I was born and raised in Orlando. I went to University of Florida and then I moved away and worked for a few years before I went to medical school. I really loved being a surgeon and doing procedures, and so ENT was like a really good fit for me. And so once I finished my training in ENT, I moved back to the Tampa Bay area and I've been here for 8 years. And so I'm a general ENT, but I focus on sinus and allergy treatments, focusing on minimally invasive procedures and different ways to help people breathe better.
Nice. We had a little similar story. Obviously, I'm from here too, but I went away for a little bit, worked a little bit, then went to med school and kind of came back too. So a little bit circling of a route, but here we are. And yeah, this is exciting. So thank you for joining me. And so the only thing different is I didn't like surgery. So I was like,
Uh,
stay away surgery. Yeah.
yeah, you either like it or you don't.
Right, exactly. Great. So we do have similar clients too. So you do the expertise on the surgical side and also managing chronic rhinosinusitis, which is something that we wanted to talk about today. So can you kind of define what that is? And maybe we need to do the abbreviation of it because there's no way I can say that chronic
Oh,
rhinosinusitis like
yeah.
20
So we
times.
call it CRS or chronic rhinosinusitis. And sinusitis to a lot of people is getting a sinus infection. And there is acute sinusitis, which is a short term problem, usually due to bacterial infection, where patients have short term symptoms that usually improve with antibiotics. And so a lot of symptoms these patients have are, fever, facial pain and pressure, nasal congestion, headache, fatigue, drainage, ear pain. There's all kinds of different symptoms, and it usually comes on pretty quick. It usually starts as a cold and then can progress. After about 7 or 10 days, you do need to worry it may be what we call a sinus infection, which is acute sinusitis. There's another branch of sinusitis, which is chronic rhinosinusitis, and that is when you're having symptoms for longer. The definition is 12 weeks or more, having similar symptoms to what I described. So facial pain and pressure, congestion, drainage, brain fog, dental pain, things like that. And so when that happens, it's usually due to chronic inflammation of the sinuses. So the sinus openings, they get really small and they close up, and then the inflammation builds up behind it. Another kind of subset of that is if you have a lot of like recurrent infections. So patients who have 3 or 4 infections a year, these acute infections where it's short term, even though it goes away, if you're having multiple of those during the year, you're also considered to have chronic rhinosinusitis.
Mhm. Yeah, that's a great explanation. I do see a lot of patients who get that confusion of, hey, I think I have a sinus infection, but it's not within that extended, like at least 7 to 10 day window. And, they're very eager to jump on an antibiotic. How do you kind of manage that thought before it becomes chronic?
Yeah, so that it's important, especially if people have had sinus problems before or they have allergies, to really pay attention to their symptoms. And when it starts kind of building up and they're like, well, it's not really getting better after about a week or so, then it's important to start looking at getting antibiotics. I always encourage people to see someone, either their primary care doctor or a specialist, because antibiotics, they do work for a lot of people, but if you take too many of them, they can cause a lot of trouble with your immune system, antibiotic resistance, your gut flora.
Mhm.
And so, I'll have patients just kind of call and be like, hey, I feel bad. I'm this and that. And I'll always encourage them to come in because, a lot of times on exam, you can see signs of sinusitis, and you don't want to misdiagnose because sometimes it's more of a chronic problem or it's allergies.
Mhm. Mhm. Yeah, no, those are really good points. I mean, the whole education about antibiotics is very important these days because we do see a lot of drug resistance going on, and obviously they can mess with the gut flora, and then we get a whole different kind of problems as well. Yeah. So you mentioned already like allergies, but what are some other common causes of chronic sinusitis?
So if you have recurrent infections, that can definitely predispose you to sinusitis. So, every time you have an infection, sometimes, especially if you don't take antibiotics always, it doesn't fully clear. And so that swelling causes backup. So your sinuses have natural openings. And so if those openings are blocked for different reasons, it can cause this problem. So the first is, like I said, recurrent infections. It swells up, the ostia or the opening closes, and then the body works in overtime to try to get them open. So they produce more mucus, the tissue swells, and then so all the natural defenses don't work as well. And then it just is a chronic cycle of it building up. So sometimes though, it's like a anatomic problem. And that's a lot of times what I deal with, where say someone's born with a natural anomaly of the sinus, which happens in a lot of people, either a large turbinate, which is a natural structure in the nose. They're important. They're supposed to be there, but sometimes if they're too big, they can block the drainage pathway. And then also a lot of people have heard about like a deviated septum. So the septum was what divides the nose. And so if you get in an accident or over time, if it bends, it can block the sinus drainage, and that can lead to obstruction. So allergies, recurrent infections, and then anatomic obstruction are really the big ones. One other thing is with COVID, obviously coming in the last 5 years, I have noticed a big shift in people's sinuses after they have a COVID infection. It really has kind of changed how predictable recovery can be for patients. So, some people will come in, they've never had trouble, and then, they'll have this terrible infection. Their sinuses look terrible on a CAT scan. And it's usually because they've had a bad COVID infection or even the flu. But the COVID has really kind of changed things because it really affects like the support cells in the nose. And so it can really make it a more chronic issue. That's something that I've been seeing a lot over the last few years.
That's interesting. I don't think I've noticed that. Like, I mean, I've seen
Yeah.
obviously people who have higher problems with asthma after COVID, but definitely, I mean, it definitely takes a role, I think, on the whole entire respiratory system. But you did mention the recurrent sinus infections, and that's when we usually think about like immune system problems, right?
Yeah, so that is something to always keep in the back of the mind. Obviously, so when a patient comes into my office, we do like a full exam. So look with the endoscope. I also have a CAT scanner in my office, so we take a look with the CAT scan, because a lot of times, like, if you just look in the nose, you can't really tell what's going on. Like, you may be able to see a deviated septum or enlarged turbinates, but the CAT scan really kind of shows, is there like some anatomical variations? Do they have an accessory opening in the sinus? Like, there's a lot of different things that are small changes that can predispose people. So yeah, that's something that we always try to focus on to make sure that we're identifying before it gets worse.
Hmm. Do you find that CRS is kind of underdiagnosed or misdiagnosed?
Oh yeah, absolutely. But I mean, it's a pretty prevalent thing. I think it's like 11% of the population. So it's a large, there are a lot of people. And that on top of that, you have people who have rhinitis, which is runny nose. You have people with allergies. And so there's a lot of crossover, between
Mhm.
colds, acute sinusitis, allergies, rhinitis, like non-allergic rhinitis, which is when you don't, but you still run. And so, yeah, it's definitely something where getting like a really good evaluation is something that is important, because it helps identify, because there's lots of studies showing the earlier you identify, the better it is for outcomes. And I noticed that for my patients, like, people will come in that will identify chronic sinusitis. I'll go in and help them with a procedure, and like, notice like their bones in their face are like thickened and like very, very like thick and not pliable. And so that's what happens over time. So to be able to diagnose it early seems to be, a good thing for patients, and something that we're able to do more often now with some of the technology.
That's cool. So what kind of symptoms or quality of life does that chronic rhinosinusitis impact? Sinusitis.
Yeah, I know it's hard to say and spell. So, the big thing that people notice is like, obviously the typical stuff, like they're congested, they're not able to sleep great, they're draining, they feel nasally, they have pressure. But some of like the underwhelming things that people don't really realize is like how fatigued they are and how much brain fog they have. And that's something I hear a lot of when people have gone through treatment. Like, they're like, oh my gosh, I can't believe I slept so good. I have so much energy. And there's a lot of studies about being at work but not really being productive. And so there's a lot of like lost income in the world with people having these chronic sinus problems but not treating them and feeling kind of crummy and only giving like, a little bit of their best versus feeling their best and doing, great job. And then also like exercise, like when people have chronic breathing issues, like they have trouble exercising, it's like harder to get that nitric oxide, get the air exchange. So it can increase the lack of exercise for people. So it's just interesting to see, how the correlation between different health conditions and sinusitis too. Obviously, we're still doing a lot of research on that, but I think as we're
Mhm.
starting to go into this time period where we're doing more personalized medicine, we're starting to see that like everything really is related and the sinuses do affect other things due to fatigue and things like that.
I would also add about sinus headaches. I think they can be
Oh
pretty
yeah, yeah.
debilitating. Yeah. And some, I mean, for me, if I have a sinus headache, it always turns into a migraine. So then it's like 10 times
Yep.
as worse. And, the productivity level really drops after that. So that's another big, I guess, impact on quality of life for that too.
Yeah, that's very true.
Yeah. So what are some common challenges patients might face before they're able to get help?
So a lot of times, people are having these recurrent infections or just feeling not their best. And, over the counter medicines can be helpful, but they're for certain things. Like, a lot of people will turn to allergy medicine, like an antihistamine, and that helps a lot of people. But if you don't have allergies, it's not going to help you. And it's just going to make you tired and dried out and all of that. And sometimes that can worsen nasal symptoms because when you're dry, your body tries to correct it. And so you drain more and things like that. There are other over the counter medicines like Flonase, and now there's an allergy spray called Astelin, and those can be helpful. But again, it can just kind of give a little band aid. And if their symptoms are more severe, it's not really going to completely resolve everything. And then there's other medicines like Sudafed and Afrin, which we know are not great to take long term. Sudafed, can be rough on the blood pressure system, but it does help decongest a lot of people. So people will pick up like a Claritin D or Allegra D and it helps, but it's not the best for their body. And then Afrin nasal sprays, is something that really can be trouble for people because most people don't read the small print that says do not use for more than 3 days. It's a magic drug. Like, I mean, you spray your nose, you're open, it's amazing. But people don't realize that if they do it long term that they're going to end up having to come in to see me because their nose actually gets more congested when they don't use it.
Mhm.
So and I think a lot of people like, they go to urgent cares and they don't have continuity of care. And so they just keep seeing a different provider each time, which is, the way our medical system is set up sometimes. But I think that's another hurdle because they're not getting that consistent care, someone that kind of has followed them to see. So that's why having a primary care doctor is so important.
Yeah, I totally agree. So I also will comment on the Afrin uses. I had a patient the other day who definitely was addicted to her Afrin, and we had to help her with that. So
Yeah.
we see it a lot. So how do ENT specialists diagnose CRS?
So part of it, it's a full comprehensive exam. Some ENTs have CT scanners in their office. Some people send it out. But the first thing we do is take a history, obviously, see, what symptoms people have had, how long they've been going on, what medicines they've tried, and do a full head and neck exam looking at both the ears and the nose and the throat because, it's also closely related. You can see signs of different things in each system, even though they're closely related. So I use an endoscope in the office. It's a very small camera which will project an image on the screen, and so I can look in the nose. I can see kind of big picture stuff. Is there an infection? Are there nasal polyps, which is really bad swelling in the nose? Are there turbinate hypertrophy, meaning more swelling, deviated septum, things like that. But really, I feel like probably the best tool we have as ENTs is a CT scan. So a CT scan is a picture of the face. The scanner that I have in the office is like a dental scanner. So it's low radiation, it's very quick. You get as much radiation as you would on a flight. So we've really come a long way because obviously that's a big concern over the years is whether or not we're exposing our patients to unnecessary radiation. But we use the CAT scan to see is there thickening in the sinuses, are there variations that are causing obstruction of the nose and things like that. And then put together with the history, kind of decide like, do we want to try medicine? Do we want to do allergy testing? Do we want to refer to an allergist, an immunologist? Or is it something that could be addressed with like a procedural intervention depending on the severity and length of problems?
Hmm. So what would you say is the role of the allergy and immune testing in this?
It's really, really important. I think a lot of people, like people will come in with obviously chronic sinusitis and, they have an anatomic obstruction. But if you fix that and then you don't identify allergies, it's just going to build back up. And, allergy testing is important for a lot of different reasons. The first is to see if you need immunotherapy to see how severe things are, but also it kind of help time medications. So like, for example, if someone just has like a seasonal allergy like to oak, they don't need to be taking antihistamine all year necessarily. I mean, they may need to, but I usually tell people, okay, we'll start it in February and let's keep it on through oak season, and then you can hopefully stop, because my goal with patients is to get them off medication if possible. It's not always realistic, but it is always a goal of mine. So I think allergy testing is very, very important, and it's always part of kind of the workup if patients are having symptoms. Allergy patients have like it can have a lot of crossover, but usually allergy patients, as you know, have a lot of like sneezing, itchy eyes, itchy nose, drainage. Like that's more like allergic, and also the congestion, all that too. But those patients especially need to have a full evaluation.
Yeah, I mean, I like how you said you try to get people off of medicine. Ideally, that's the goal, and I think you're going to tell us, but offering allergy immunotherapy kind of has that idea of getting you off of it, right? So we give,
Yeah.
very personalized mixes to the patient based upon what their results are on the testing. So what are some other options with allergy immunotherapy, since we were discussing this before a little bit?
Right, exactly. So there are different types ways to administer it. There's allergy shots, which is kind of the gold standard. Allergy immunotherapy is, you have an injection and it builds up over time to help the patient not respond as heavily to the allergen. And this is, the gold standard. It is very effective. It's not a quick fix, as you know. It does take time. Most people, I tell them you're going to be in the office like probably once a week for the first year. That's not always true. You probably can speak to this better than I can, but it's a really great thing, and I've just seen people improve so much over the years. So that is something where you have to be in the office to have it administered, because there can be reactions, but it really does work well for patients. Some other ways to administer immunotherapy is sublingual therapy. There are some prescription sublingual options through some of the pharmaceutical companies for specific allergens like grass and dust mite, and I think weeds now too, but those are administered every day under the tongue, and it's a slower kind of response. But there have been a lot of head-to-head like Cochrane reviews, and the jury's kind of out. I still think that for severe allergies, shots are the best, but there's a lot of sublingual use in Europe that it's something that patients like, because it's a more convenient than having to go to the office. But I think you kind of give and take with them. The other downside of sublingual therapy, a lot of times it's not covered by insurance, so
Mhm.
it's out of pocket for patients, and so that can be a hurdle for people for sure.
Hmm. Well, just to clarify, since you mentioned it, the for typical textbook buildup is about like 6 months or so, and then it should start working. So
Yeah.
yeah, like maybe once or twice a week for 11 weeks, and then we go every week after that, and then you kind of separate it out. And then it's funny you mentioned the Europe thing. So I had a patient who was getting sublingual therapy in Europe, and we don't do sublingual therapy at our office, and she was wondering why and things like that. And I'm, well, I can refer you out and things like that. But I just didn't know I don't know what they do in Europe. So
Yeah.
it's a totally different medical system. So it was a surprise to me, but it's really interesting. Good. So what other kind of things do we use to treat this besides immunotherapy and, well, I guess the types of immunotherapy?
As far as allergies or
Oh,
sinusitis.
well, if you have
Okay.
anything more to say about allergy, that's fine too. I was going to ask you more about the surgical part, I guess.
Oh yeah, yeah. So yeah, like like we talked about, allergies are important to treat, and that's really just like working on the immune system and the
Mhm.
actual systemic response. And I've touched a little bit on like anatomic changes and how it can affect, and chronic
Mhm.
infections, chronic inflammation. So there are medications like short term, if you catch it early enough, that sometimes can help get the sinuses open enough where you don't have to have any type of procedure. So allergy treatment's one if you need it. Topical steroids in the nose. There are different formulations now. There's some newer stuff that gets a little bit further up in the sinuses, and that can be really helpful for patients. Again, it's not super quick. It does take time because you're working on, years sometimes of inflammation. But in my practice, if people come in and they have obstruction or they have mucosal thickening in their sinuses, really the best way to address it is by getting the sinuses open and draining and removing the obstructions so everything kind of flows the way it should. And once the sinuses are open and clear and cleaned out, then the body kind of heals itself. The mucus cells, they stop producing so much mucus. The cilia really start beating out efficiently. So it's really kind of cool to see, how well the body can heal itself when it's in the right environment. And so I use minimally invasive techniques. Most of them are office based. So it is nice for patients. They don't have to go under general anesthesia. So it's a local anesthetic that I use to get the nose nice and numb. And I use small tools to go into the natural openings and open it with a balloon dilator. And it just augments the sinus. So it's much more open and it's able to drain. So most sinus openings, if they are open even a little bit, it's just a couple millimeters. And then the balloon, it opens up to about 6 to 7 millimeters. So it's not like a huge opening, with the balloon, but that circumferential change, it's an exponential change in like airflow. They've done studies looking at like nasal obstruction and sinus obstruction. And they did a study where patients had like a wide open nasal cavity. The turbinates were small, the septum was straight, there was no obstruction, but their ostia and their sinuses were closed and they still felt congested. So it's not just one area of the nose that's doing everything. So you have to kind of look at the whole picture. So I do the balloon sinuplasty to open up the sinuses. At the same time, I usually reduce the turbinates if they're enlarged. So I use a little tool that does a submucosal resection, meaning that it's kind of like I explain it like liposuction, like you just kind of debulk the tissue so it's not so bulky. So you have a lot more airflow. And then, sometimes some other turbinates can be enlarged, so I'll reduce those. And, sometimes if the septum is a little deviated, there are things I can do easily in the office where it gives people a lot of room and they're able to breathe without a big operation. But, everyone is so different. Like that's one of the reasons I love sinus surgery, because it's like very predictable, but it's also like very different for every patient. So like, even though the basis of everything is similar, like sometimes I have to do a little bit more for some patients. Sometimes I have polyps I have to remove. Sometimes I have to go further back. Like there's all kinds of different variations of what I do in the office. And, every patient has a different plan because, everyone's different. And so that's where the CAT scan is really helpful, because it can help me determine like what's a personalized plan for that patient.
Yeah.
Yeah. But people, right?
Oh, go ahead.
Yeah, I was gonna say they do great because, the thing that's nice about not going under general and kind of the technique, because it's less invasive, the downtime's pretty quick. Like we tell people like a day just because everyone's different, but most people it's the day of, like they're home, they're recovering, and then they're stuffy after for a few days for sure. Like it's not like you're back to complete normal the next day, but you're able to kind of get back to life compared to like sinus surgery, which can be pretty hard to recover from. It usually is like a 5-day recovery, but some people need that. So, but it's usually a pretty good recovery for people, and it's nice. It's really nice.
Yeah. So with the balloon sinuplasty and like turbinate reduction, how long do those improvements continue to last?
Yeah,
It
I get that.
obviously varies, I'm sure, but
Yeah. I get that patient all the time from patients, because obviously like no one wants to go through a procedure if it's not going to give them long-term results. And so it's usually about 85% of people have like a long-term improvement. This is something where it kind of depends on their baseline though. Some people are more severe, they've let it go longer, they have polyps, they have fungal debris, there's all kinds of different stuff. So those people, it's kind of, I tell them like it's possible you may have a revision. But for people, with just chronic sinusitis without anything crazy going on, like it's a long-term result. I've been doing this procedure now like in practice for 8 years, and so I've had patients that I've did many years ago that have come back still having good results. They still have open ostia, like everything looks good. But it's interesting, even the patients that you may do like more invasive stuff, like an actual, like what we call a functional endoscopic sinus surgery, where you actually cut open the sinuses, even those people have a revision rate of it's actually a little bit more even than the balloon sinuplasty. So I just always counsel people, because a lot of people, they're fine, but obviously there's certain times, especially if you don't diagnose the underlying problems like allergies, it can come back. And COVID's another one that's kind of like thrown a wrench in things. But yeah, I mean, the technology's been out for almost 20 years. It's just something that we're still learning about and all that. And the techniques have really improved. So it's something that most people will expect like a long-term solution, because you're actually fixing the anatomy to hopefully prevent any future problems.
Mm-hmm. Cool. Okay. Yeah,
Yeah.
honestly, with the COVID comment again, I think it's really immune system dysregulation with COVID too. So maybe that's why it's leading to more, chronic sinus infections.
You're 100% right. Yeah.
Yeah, I didn't think about that. So, just to tell you about a patient I have. So, this guy, 60 something, has been on allergy shots for several years. He's only noticed like minimal improvement. He has severe asthma too. He's on like chronic nasal, steroids, even oral every other day steroids for the asthma. And the asthma's not too bad, but he has a little bit of a deviated septum. He does have a diagnosed immune deficiency, not enough to be on immunoglobulin, but I feel like we had a conversation recently. Is like, when is it time to fix this septum?
Yeah.
Because his biggest complaint is still, chronic rhinosinusitis. So where
Yeah.
and when and what would you do, like the next steps with these kind of patients?
Yeah. So, that is always an important question because, obviously procedural surgical intervention is something we try to put until patient really needs it.
Mhm.
And so, for that type of patient, because he continues to have issues, I would, say it's something to at least look at. However, it's interesting. Like I have patients come in they come in for a deviated septum, like that's why they come in. And then when we take a look, obviously there's some deviation. Sometimes it's really bad and it's completely obstructive, but sometimes it's just kind of like a little bit of a sway where it's a little more narrow on one side. But the real problem is behind, which is the sinuses and the turbinates. And so I have so many patients that have come in and we've talked about, do we do a septoplasty? Do we start with less invasive? And I would probably say the majority of patients that we do the less invasive, just deal with the sinuses, the turbinates, they have so much improvement they don't need a septoplasty, which is kind of like a weird thing as an ENT to like realize, because like that's like one of our favorite surgeries. Like that's what
Yeah.
you're trained with. You start doing it as a second year resident. And for some people it's like really important, but it's just really like nice to be able to give people an option where like they're not having a big operation and they're able to like feel better, because it's all about like obviously optimizing the airflow mechanics in the nose. So say that patient has a little bit of a deviation and their turbinates are big, like if the air is getting kind of stopped up as it goes, it's shearing against the mucosa, it's causing more inflammation, which leads to more like risk of infection. So there's a lot of stuff like that I think we're still learning about. But for those patients who come in who've kind of like tried everything else, and they're still having symptoms, 100%, like it's something to look at because it can really help people. And I think the big thing is like also like sleep quality and energy during the day. Like that is the biggest thing I hear from my patients. Like, oh my gosh, I sleep so well. And sleep is tied to everything. Like, I mean, if you're going to ask a patient how they are, you ask, how are you sleeping? Because that's really like, it's such an important indicator of health. So anyways, I'm rambling a little bit because obviously like I just, I love to see people get better, because we have a lot of patients that come into our office that have like are really frustrated with seeing people and not getting like any type of answers and things like that. And so it's just nice to be able to like listen and help people and like get them feeling better, because
Mhm.
it's awesome.
Do you see any overlap with a sleep apnea?
Yeah. So yeah, sleep apnea is a huge problem, as you know, and it's a very important problem to diagnose because it does affect health, and obviously your risk of heart attack, stroke, all those things, obviously being exhausted and fatigued. But a lot of people come in for snoring. And so snoring and sleep apnea go hand in hand. But a lot of times, snoring is more a symptom of an anatomical issue. It can be the nose, it can be the palate, it can be the base of tongue. And so, kind of teasing that out is important. A lot of people, it's just nasal congestion. And, if you fix the septum or the turbinates or whatever's going on, about 70% of people's snoring improves. But you still have to think about the sleep study, because you don't want to miss a diagnosis of someone not breathing at night, because obviously it's impacting their health. And so we see a lot of patients who have snoring issues. That's what brings a lot of people in. It's usually the wife that makes the appointment, and then the patient comes in, and and then we'll sometimes do a procedural intervention first to get the nose open to see how they do, and then do a sleep study to really optimize their CPAP usage if they need that, because when you have congestion in the nose, it makes it harder for patients to tolerate. And so,
Mhm.
there are a lot of options now where you don't need a CPAP, but it's still the gold standard. So trying to get people like optimized on that is important.
Mhm. Yeah, I was going to bring up like we already know they have sleep apnea and they're trying to use a CPAP, but they can't breathe out of their nose. If it's like a nose one, then it's like They can't really do the
Yeah.
option, right? So it's
Yeah.
definitely related. Yeah. So what sort of, I guess, things can people do every day to support their sinus health?
Yeah. So the first is just like trying to, be healthy in general, getting good nutrition, trying to eat whole foods, getting sunshine, exercising, sleeping, good sleep hygiene. All those things are obviously really important because that's going to lower the inflammation in the body. The other thing is, one thing that's really helpful for people, especially like if you're having like an allergy flare or something like that, is nasal saline, whether it's a spray or a rinse. It kind of depends on what you can tolerate. The spray is really good because you just spray your nose, you blow it, it gets rid of allergens, it helps kind of like moisturize the nose. So it helps with sinus health. So that can be really helpful. And doing that daily is something that a lot of people will do that notice a nice improvement in their nasal breathing. There's also like nasal sprays, or I'm sorry, nasal rinses and mist with xylitol in it. And xylitol is a really novel thing that actually helps decongest the nose temporarily and also helps with viral adhesion. So there's some certain brands that have xylitol in it. So that can be something that can be like a non-medicine based option for patients. And then, like, if you're having symptoms, like just not ignoring them, like trying like a Flonase over the counter, if you're having an allergy filler or doing an antihistamine. Again, these are things you can do just to like get through it. But if it continues, it's really important to see someone to kind of evaluate to make sure you're, treating the right thing. And I'm trying to think if there's anything else. I mean, there's obviously it's just kind of out. I think we're going to see a lot in the next 5 years about like the whole body hypothesis, inflammation, different markers and things. And so just trying to stay as healthy as possible, definitely correlates with health. I do notice, or there are lots of studies showing a link between obesity and chronic sinusitis. And I do see these patients, like the way their sinuses kind of like develop and the thickening of the bones and stuff, it's just so different when they're obese. And it's just really interesting to see that correlation. And so it definitely, there's some type of connection. It's just like what specifically, it is. It's, I guess we'll find out with all these new weight loss drugs and things like that.
Yeah, I mean, as far as obesity is a inflammatory condition too, right? The fat cells give off inflammatory markers, and obviously that could lead to more inflammation, and more inflammation is going to lead to inflammation everywhere, right? Not just in one
Right.
spot. So it definitely could affect the sinuses. We didn't really mention it, but like some of the like biologics that are used for like nasal polyps and stuff also are like targeting some of these inflammatory markers as
Yeah.
well. Yeah.
The biologics have been a huge advancement in ENT and
Mhm.
other fields, dermatology, asthma treatment. So, there with some nasal polyps, especially those patients who have asthma as well, it's an inflammatory or immune problem. And so, doing procedures, removing polyps, all that, it's great, but it's almost futile sometimes because they just come back. And I think it's probably one of the more frustrating things as an ENT is to deal with nasal polyps because really you can offer them steroids, which are terrible for them, but they help obviously, but it's like not a good long-term thing. And every time you do surgery, the risk of complications goes up and things like that. And so these biologics, they're a twice monthly or sometimes monthly injection that targets a deficiency in the immune system, as you know. And it just, I mean, seeing these patients, like the polyps just like melt away. Like it's just the coolest
Mhm.
thing. Recently, a lot of ENTs have been using them like pre-op for bad polyp patients. Like before we go and do surgery, we'll actually start them on a biologic to help reduce the polyp burden, and it helps the surgery be more effective and less difficult, if that makes sense. And the patients do better because that inflammation's down. And that's the key. But they are long-term drugs, like it's not something, it's kind of like Ozempic. Like once you get off of it, if you don't change your lifestyle, things are going to come back. But same thing with these biologics. Like when you stop, the question is like, how long does it take to come back and things like that. It's a piece of the puzzle. It's a tool.
Mhm.
Like there are other things, like you have to look at allergies, you have to look at the obstruction, you have to look at the whole body inflammation and all that. But they are awesome. Like it's been great. And there's I think like four now we use for nasal polyps, which have a lot of crossover with asthma and skin conditions,
Mhm.
things like
Mhm. Yeah, I think it's nice to see the ENTs embracing the idea of using that a little more, whether it's like pre-surgery to reduce the polyp burden and make the surgery easier, or even, continuing long term. Have you any experience of like stopping anybody on them and it grows back or
that.
yeah?
Yeah. Yeah, like I have a patient, he started with another ENT and was on it, couldn't get it due to cost because these drugs are extremely
Yeah.
expensive. They have a lot of programs to help patients, but like if they're not covered, it's crazy, thousands and thousands of dollars. So he stopped it and like his symptoms just got so severe. And so you just, obviously I saw the pre-op scan and then they had another scan and then he came to see me. So I saw the kind of progression and now, he's back on them because we got him back on it. But we did, do a little bit of work just to help open up some of the sinuses so he could get some nasal rinses up there. But yeah, so they do come back. Some polyps, though, like honestly, some people have polyps. It's like an obstructive problem, or it's due to like a fungal ball or something. And so once you get everything removed and open, as long as you treat it effectively with like nasal steroids for like up to 6 months after, sometimes they just go away. So there's two different types of polyps. So that's why I always tell patients, there are two different types. One is like more of a lifelong thing. One is more, due to obstruction. And so there are certain like markers and stuff that you can look at to try to determine which is which. But a lot of times it's just the clinical course to see how they progress and trying to, address that.
Hmm. Yeah, it's nice to have that in our toolbox, like you were saying.
Oh
So
yeah.
it's a great addition. Is there anything else you'd like to share regarding CRS topic?
Obviously I'm very passionate about it. It's something, obviously that affects a lot of people, and everyone knows someone with some type of sinus or breathing issue. And I guess what in my practice, like one thing that I love is that we're able to offer like solutions that aren't so scary to people. I mean, obviously it's still procedural, but it's something where most people will come in and like they'll be like, I can't believe I lived with this for like 20 years without coming to CNT, because everyone's scared they're going to have this big operation, splints in their nose, all this stuff. But it's just nice to be able to give people an option where they do feel better and they recover really quickly. So it's been great. I'm proud of it. We have a lot of happy patients, and it's just been wonderful to serve the area and do something that I love and that makes patients feel better.
Yes, I think we share a few patients, and I know they had good experiences as well. So it's always lovely to hear, direct feedback from patients as well. So awesome. So where can people find you if they want to work with you or see you as a patient?
Okay, yeah. So probably the easiest way is to go on the website, www.tampabaybreathefree.com, and breathe has an E at the end. And we have an online scheduling option on there and everything. Also, if people want to call the office to make an appointment, number is 727-493-2479. And we have social channels and stuff, but I need to get more active on that. But yeah, and the thing is we try to see people pretty quick. Like, we usually try to see a new patient within the week. So yeah, I would love to meet more people in the area.
Fantastic. Well, we'll put all that information in the show notes. And thank you so much for coming on the podcast today. This was a lot of fun. And
Absolutely. Thank you so much for having me.
all right, everybody, stay tuned next week for next week's episode.